I'm Tara Schappmeyer, and a co-investigator on the Crew Geek grant, and I'm here today to talk about how we kind of run the interdisciplinary case management experience sessions and the critical reflective writing sessions so that everyone has a better understanding of how to facilitate these things.
And I'm Barbara Head, also co-investigator, and helping with the training today.
Okay, so thanks for being here. Thanks for watching. The point is just to really make sure everybody feels comfortable thinking of both of these things, the critical reflective writing session and the small groups in the ICCOA sessions as small group facilitation. So we have some handouts here for you, and we're just going to kind of go through the agenda really quickly. We're just going to start, well, we've already kind of done our little icebreaker on sharing of stereotypes. So we're going to move into just some important skills for and tips for IPE facilitators, IPE being interprofessional education. Also, we're going to talk a little bit about how to respond to students' written reflections and even verbal reflections in the small group setting. And then review an actual facilitator guide and how we kind of go through the ICCOA session so you can know what to expect. And then have some time for questions and discussions. So just to start it all off, Barbara found this great quote. The thought for the day and the thing that we want to try to go in to each of these sessions with, the attitude is that our role is not to be the sage on the stage, and that's very, very tempting for all of us, but rather the guide for the ride. So really it's about them, it's about the magic that they create as an interdisciplinary group of professionals, and those of you, I think many of you have already kind of participated in interprofessional education already, and you already know how important it is to just kind of sit back and let them do their thing and give them feedback. So then what we have for you are some handouts that Barbara found and put together, starting with 10 tips for interprofessional education and some general IPE facilitation principles. We're not going to go through them word for word, but also a reminder of some of the Socratic Teaching principles, and then some specific points on how to respond to the critical reflections. So if we start with the 10 tips for interprofessional facilitation, we'll just kind of go through that.
So I would just add here that these came directly from the National Center for Interprofessional Learning in Minneapolis, Minnesota. Mm-hmm. And the website is listed here. And they actually have some excellent tools for facilitators. And they have one scenario where they present you with situations and you have response choices. And I went through and did that, and it's very interesting to think about what's the best response to a student when this happens. So I would highly recommend that you visit their website and look at their tools.
So when I look at these 10 tips, this is, as I was reading through them, this is exactly kind of how I prepare myself for going into either the reflective writing session or the large group facilitation or small group facilitation in the ICCOA session. You know, I always think, okay, what do I need to do to be prepared? What do I need to be thinking about? And if I need to remind myself of like the typical questions that I ask when I go to the small group facilitation of the critical reflective writing, Barbara's going to go more in depth about having the preparation part where you actually read their reflective writing papers, because that's a big part of it. I've already done that. I'm getting ready to go to a session. So I think about, you know, I pull out my facilitator guide, which you'll see, and I think about the typical questions that I ask. And so that's just kind of preparing. It's usually very brief, but I try to get myself into that emotional and space before I go into the room. And then I try to get to know my learners. If I haven't already through what I read in their reflective writings, I usually will have a writing or two from a nursing student, one from a medical student, a social work student, a chaplain resident. And so I can get to know them a little bit just by what they write about in their typical, the reflective writing templates that all of the students get. And they write a little bit about what they saw. They pick out a patient that they wanted to talk about, and then they tell a little bit about the interdisciplinary interactions that took place, the teamwork, and they critique it. So I get to know them that way. But when I come into the room, the point number 2 is know your learners and invest in the beginning. I try to say right off the bat regarding the critical reflective writing session is, you know, I thank them for coming. I start to ask for introductions. Who are they? What year are they in their learning program? And we have an hour to get all of this done. And so it's usually pretty quick. And where do they hope to be when they finish? And then I tell them a little bit about myself, my background in palliative and oncology social work. And then
if you're in just ICME, some of you might not do reflective writing. You might just facilitate an ICME small group.
Mm-hmm.
And we do an introductory exercise like we did today, where they share stereotype and they introduce themselves and their discipline. And it's really important, I think, that every learner speaks up during the introductions.
Yes.
So you set that norm that everybody talks in this session. So you really want to pull them out, and that's a way to learn about your learners too. In ICME is through that exercise.
Right, so we kind of really set the stage. The point of today, the point of coming together is really for you to learn about and appreciate each other. We appreciate you. We have all been a part of, and say this if you've done this, we've all been a part of amazing interprofessional teams that actually made us better professionals. I think it's my teams that ultimately encouraged me to go pursue a PhD. I was always at the top of my game. I had to be among my interprofessional colleagues. And so I kind of say that to them, and I say, this is kind of what led to me being really happy and finding meaningful work, because I had such a great team to share all of the challenges and triumphs and things with. So I kind of, that's part of the all three of the above: being prepared, knowing your learners, and then creating that safe environment. And I tell them, oftentimes chaplains and social workers are really encouraged to be reflective practitioners. And the point of the reflective writing is really about being a reflective practitioner. Nursing students, nurse practitioners, and physician students are increasingly encouraged to reflect on their practice, but it's not like an ingrained, I don't perceive it to be an ingrained thing, an ingrained part of every single part of their education, as much as it is with social work. It's almost like debriefing is automatic after everything. And then I say that's what the point, that's what the whole point is, to reflect a little bit about some challenge or some patient that you observed. And so then you kind of, in creating that space, that's all in engaging and trying to get them to know each other and feel comfortable kind of talking or sharing some of their writing. So that is everything on the first three items that I really wanted to talk about. Moving on to number 4, understanding and responding to group dynamics. So if you've done any small group facilitation, classroom teaching, you have an understanding of how to pay attention to group dynamics, how to make sure that every voice is represented, every profession is represented, and if it's not, to pull out, to ask questions that will allow the person who's speaking less to potentially speak more if necessary, and also say things that I hear myself saying all the time to the one who ends up answering all of the questions first. That is such a great perspective. Now I'd like to hear the chaplain perspective, or the social work perspective, or the nursing perspective, and that's a very kind way, and everybody does a little bit different, but it's a kind way of reminding them, okay, you've had a lot of great thoughts and things to share, but let's hear from others as well. And so that kind of touches on encouraging diplomacy, number 5. Are there different ways? Some people I might say, I'm going to ask you some questions, and you can pull from what you wrote, because the questions are similar to what you wrote in your reflective writing. So you can pull from what you wrote and just read it if you so desire, or you can just talk. It's whatever, whatever you feel most comfortable doing. We're not forcing any student to read what they wrote if they're not comfortable doing that. And then really being that positive role model. One of the things that I try to do as far as role modeling good collaboration and respect for other professions is when you hear like a medicine student, for example, or an NP student say some specific acronym or something that's about a medical procedure that perhaps the social worker or the chaplain might not know, then I will quickly say, if I don't know it, I'll say, what's that stand for? Or I'll go ahead and tell the others in the room, because I just assume automatically that maybe everyone in the room doesn't know, especially when we get into acronyms. So it just promotes a recognition that not everyone speaks the same language, and you try to find a common language that everyone at the table can understand. And then there's some good questions in number 6 that I haven't used, but I think I might consider using in my small group facilitation in the critical reflective writing session. What do you think are the barriers that prevent interprofessional practice from being adopted widely in our current healthcare system? And what are some of the changes that you as a future professional can make in the future around promoting interprofessional practice? My most typical questions are, what did you see? Tell us a story about the patient. What team members were involved? What team members were missing? What did each team member offer that was there? What could the team have done differently or better? The ones that were missing, what might have looked different had they been there? What did you gain from this professionally? Is there anything you gained from this personally? Those are typically the questions that I go through.
And do you have those, or?
Yeah,
It's in the last handout.
Okay.
Yeah.
When we talk about reflective writing.
Because the only reason I know it by heart is because I've actually read that facilitator guide before I go in, but
Right.
every single time, over several times. Then monitoring the situation, things like body language and eye contact, and just, all the things that we all know about promoting good group dynamics. Maintaining neutrality and sensitivity. Add your profession-specific perspective to the conversation, especially if that one is not represented by the learners in the room. And that frequently happens in our interdisciplinary case management experiences and in our critical reflective writings, because the numbers of learners going through are so different. So, and then as you do it several times, you'll start to have a better understanding of the common perspective of the others in the other professions that you might be able to offer. For example, if a physician student isn't in the room, what might be adding to the conversation that you can offer as a facilitator if it's just a group of nurse practitioner students and social work students. So that kind of thing, just promoting a recognition for the need and voice of all the professions. And then focus the conversation on interprofessional practice as much as possible. When they get into talking about, well, the doctor did this, but should have done that, that's fine. But again, try to help them continue to think of the patient and the family and the whole team as identifying and addressing the problems together and dealing with the problems and challenges together. To keep the conversation, I use a lot of they and or we in these conversations versus should you do or what should he do or whatever. And then I do a lot of kind of summarizing and closure at the end to show them that I've actually been listening and heard what they said. And I also express gratitude many times for what they've contributed to the day and for giving us their time. And often tell them, in the reflective writings in particular, on my written feedback to them, if I think they should be writing again in the future, I encourage that, because sometimes we've had some pretty amazing reflectors and who are also really good writers and think they could contribute a lot to the literature by just offering those occasional reflections. So that is everything that I kind of really wanted to go through on the tips. Is there anything else I missed that you want to make sure I covered?
Well, I think it's always important for us to think how we can rephrase a question rather than a statement coming from us. Because there will be times when you see things that they say that are really in error according to practice. I especially saw this in palliative care groups where they would talk about, or say somebody would say, you don't want to give the patient too much morphine because they'll stop breathing, or a real clinical issue. And it's better if you can just ask the group, what did the rest of you think of that, or what did you see related to that during your clinical experience, and have them come up with the answer. But you do need sometimes to correct something, a perception that's wrong that the students have. Like, I thought the only thing social workers did was give cab vouchers and help with medication costs. And then you might just rephrase that, well, what did the rest of you see social workers doing in this setting? Rather than giving a lecture on what social workers really do. So always try to get the focus back to the learner. And it's hard to do. It's hard to think in your mind, how can I ask a question about this rather than giving my knowledge about this? But it's so much better if it comes from them. So always thinking on those terms about questions rather than answers as you respond to students.
Yeah, that's a good point, because they were all grappling recently at one of the sessions that the student was grappling with a particular patient challenge, and the way they were describing it, it sounded like PTSD to me, and so I just kept asking, okay, you said some words in there that kind of rang some bells for me. Did they ring bells for anyone else? And if so, what were the words, versus saying intrusive thoughts, waking up at night, that sounds like PTSD is what I was thinking in my head. So, but with practice, it starts to come more naturally. So then the next handout is the general IPE facilitation principles, and that just kind of reiterates the stuff that we've already talked about. Those of you who are watching on film will obviously get copies of all of this. Just some other additional tips. I don't think there was really anything in here that I didn't cover in the other version. One of the things I do frequently in the ICME session on dealing with difference and conflict, make time to explore similarities and differences. So when there's a challenge that they're grappling with at the table, whether it's pain, for example, or some other thing, I will ask questions like, well, how might, nurses and physicians, you're talking about the pain and what you're going to do about it. How might the social worker address physical pain? How might the chaplain address physical pain? And what assessments and interventions might they offer that would also kind of improve decrease pain, decrease physical pain for this person? So it'll be things like that. And I might then say, how might a nurse practitioner address a spiritual need that a patient has? Because it's not just the chaplain that does that. Really all of us should be thinking about all these things. So that's kind of one of the things that we try to do. Then on the last page, and jump in, Barbara, if I'm forgetting anything, the Socratic Teaching. It's just a reminder of that really great method. And the things at the bottom are the best parts to really try to remember. Keep the discussion focused. Keep the discussion intellectually responsible. Stimulate the discussion with probing questions. Periodically summarize what has and what has not been dealt with or resolved, and draw as many students as possible into the discussion. And it's really about critical thinking, forcing the students to be critical thinkers. So that's everything that I think I have. So thank you, Barbara, for finding these and putting them together. So we're going to get more into the details of the how-to, and I'm going to turn it over to Barbara for that.
Okay, so next we're going to talk about how you respond to the reflective writing. And I would refer you to the handout that says Responding to Critical Reflections. So we have a template that we use for our critical reflections where the learner describes a patient scenario, a little bit about the patient background. Then they go into the care of that patient, what they observed that was good, what they observed about the team functioning, in this case, what they observed about integrative community care that's person-centered. So they kind of critique what they saw. And then in the end, they talk about how that impacted them personally and professionally. So that's kind of the template for their writing. And we will get those papers and respond to them. We know that reflection is a very important part of learning. It is part of that cycle. To have an experience and not to reflect on it, it's kind of a dead end, because by doing these writings, they really think through their experience and analyze it and evaluate it. And then by sharing it with others, you complete the whole learning cycle, because you get their reflections, their reactions to your reflection. And it's very important that we have that part of the cycle, that students don't just do these reflections and they're lost in space, They don't get faculty feedback and other learner feedback, because that is part of that experiential learning cycle. So it's important that we take time to read and reflect on their writings. And at Brown University, they've done a whole lot of work in narrative reflection and reflective writing and how to respond to reflective writing. And this outline actually comes from Hetty Wald that came and did an in-service for the ICCOA facilitators. And I hear she may be coming back to do an educational grand rounds here at U of L soon. So hopefully we'll all be part of that. But she came up with a scenario that really helps as you go through the student reflections. You might have a mode that you're more comfortable with. Some people actually write a response on their computer and print that out and give it to the student. I'm an older educator, I guess, and I like to write in the margins. And so it's whatever is comfortable for you. You could actually print out the reflection and move the margins in so you have more space to write on the side. Just whatever you're comfortable with. But the first step is to read through the whole reflection and then just to kind of get an overall impression of what the learner is trying to say and kind of your gut reaction to what the learner has said. I think it's important to remember that reflections aren't right or wrong. They're reflections. So they're whatever that learner experienced. And we want to be positive in our feedback rather than critical of how they saw it. So always think of ways you can ask questions and reframe things in a positive way as you respond to learners. So then you might record your initial impressions that were triggered by the learner's written expression, at least in your mind. Think through and summarize what you've seen as you read the writing through the first time. And then the third step is to reread it and really analyze the text. And you might underline quotes that they made or feelings that they expressed. You want to extract key themes, extract the lessons they've learned and summarize those lessons. And also additional considerations. You would want to ask additional questions to get them to reflect even deeper.
Before you go on, I just had a question, and I'm sure I probably should know this, but the directions that they're given for this exercise, I mean, I've done some of these before, and sometimes it's not that what they're saying there's an issue, it's just the depth of reflection.
Yes.
It's very cursory. It's today I did X, da 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 da, I saw this patient, I got to do,
Right.
but there really isn't the depth of reflection that we're looking for. So
Right.
when they get the information to do this, how are they guided, I guess, would be my...
Well, you know, it's set triggers, questions like,
Okay.
you know, first describe.
With word limits on the description.
Yeah,
Okay, that was my
Yeah.
next question. 'Cause
Describe-
sometimes people are, way
Oh,
over the
yes,
top.
yeah, right. I think we decided 2 to 3 pages.
Okay.
Yeah,
Right.
max, and then it's like very, like this much on the typical side of your,
information, yeah.
yeah, this much clinical, don't use too much medical jargon, just describe
Yeah, I
the
don't want to
patient in
spew
general.
forth of the steps of what you did.
right.
I want you the reflective
Yeah,
piece
I was
of
gonna
it.
try to pull it up
Right.
and see if I could
Right,
find it.
but you're right, Whitney. Sometimes students don't go into depth, and you always wonder, well, were they just, breezing through this and didn't want to take the time to respond in that way? But I think some people truly haven't developed that skill yet.
Yeah, I
of
would agree.
reflecting. So I always approach that as, what questions can I ask them to get them to think about it differently or
Right.
more deeply? So I respond with more questions rather
Sure.
than saying, this is, vague and you didn't put effort into this.
Right, no,
'cause
sure.
Some learners just aren't there yet.
Right.
So we need to direct them and kind of lead them down that path a little bit more. So then you want to craft your feedback using their major themes and the lessons they learned. Again, reflection, inviting questions to ask more questions. You seem to be upset by what you saw in this situation. How do you think it might have been handled better? Or you were very impressed by the team. What were the good qualities of the team that impressed you so much? To get them to go deeper with their reflection. And you use their actual quotes and kind of summarize what they've said. Again, coaching rather than making evaluative statements about what they wrote. I have a list of questions there that you might use in your feedback to the student and in the small group discussions to get them focused on what we're trying to teach them. So questions like, what were the social determinants of health that impacted the care of this patient? How did the practitioner's actions influence the outcome? How did you feel about what you observed? Like Whitney said, sometimes they don't go into that depth of feeling or reaction to what they actually saw. They more describe it. It's safer just to describe it rather than to go deeper and say, this isn't exactly what I think would be ideal, or this wasn't what I learned about this model. So encourage them to go down those roads and really think deeply about the experience. Ask them about assumptions they made going into the situation. What was puzzling to them? What skills did they learn? What new insights did they develop? And how they'll apply it in their future work. How they might have done it differently. What would be an action plan for improvement of this patient's care? Did you observe anything you weren't uncomfortable with? So again, those probing questions. And you might use this in responding to their writing, or these might be questions you raise in the small group of interprofessional learners to get them all to share about these things.
Is it okay when you're giving feedback for their writing to actually affirm what they're saying by like, oh, I had that experience once?
Oh, yeah.
Okay.
Yeah. Right.
Yeah,
Or
like
I agree with you.
Mhm.
That is difficult
Right.
when this happens, or
Yeah.
Okay.
And every small, like this is overall feedback, but every facilitator does it a little bit differently. I started out writing like a separate Word document, or actually I started out actually doing comments on the electronic Word document. I would select a section of the Word document and I would do a comment off to the side about it. Then I eventually moved back into just printing it off and handwriting things. But I would underline like great statements or statements that I wanted to ask a question about, and then I would write the question off to the side. And obviously you're not going to get the answer to those questions.
Sure.
They're not going to turn it back into you, but I give this at the beginning of the reflective writing session. So I might ask 2 or 3 questions, and I'll say, if time allows, depending upon the number of learners, I may say, was there anything that any question that I asked any of you that you would now like to be able to answer, something like that. But it's a lot of just amen, yes, right on.
Yeah,
I do a lot of that.
I didn't know if that was
Exclamation point,
Unfortunately, this happens too much.
Right.
Or I've seen this happen in my career.
Right, exactly.
Yeah,
Yeah.
okay.
Right, yeah.
And then
That shows them that we're reading, really, that's
Right.
ultimately we
Yeah.
want to communicate to them that we have read what they wrote and we appreciate what they wrote.
Yeah, that was heard, so.
Mhm.
And I'm confused when we get the writings from them. It's before the facilitation.
Yes.
Right.
And when do they get it back from us? Right that day that we're facilitating the small group discussion, or do they get it back a few days before?
No, you can just take it to the small group session, because many of us will be reading them right before we go, in that morning before we go.
Okay.
I mean, that's what I do, because I want to be able to remember what was written. So I usually block an amount of time
Okay.
before the session so that I can get it done.
And it helps you prepare questions for the total group.
Right.
Yeah, if you see patterns. And Tara said she gives hers back before the group. I always give mine back after. So it just depends on what you're comfortable with.
Oh, okay.
Yeah, so.
That makes sense.
Okay. So then we move into the small group discussions of the reflective writing. And again, we hope to have a representative of each discipline in the small group so they can share their different perspectives, because it's different based on their disciplines. So to bring that out and say, what's the social work perspective on this, or how would other team members see this differently than you as a physician, or depending on the learner.
So will each student have, because they're all going to have different scenarios or experiences that they've written about. So I'm looking at some of the questions. So do you pick a particular one to kind of use as an example, or do each person get to respond about their writing? How does that?
So I start by, after we've done introductions, I'll say, now let's just briefly go around the table and describe your patient a little bit and the team that you worked with, and then maybe what some of the challenges were, one or two of the challenges, or you might separate that piece. It might be just tell us a little bit, and then we go into challenges in the next round. But I just put the question out, and it usually ends up being kind of around the table, one after the other. But sometimes, I say it doesn't have to be, anyone can speak up. And then, with each of these questions, you put it out there, and then they each end up going around and reporting, kind of answering that question, and then also sharing, challenging each other. Are there any thoughts that you had in listening to what Whitney just said about so-and-so patient, and that kind of thing?
Mm-hmm. Right, yeah. So I always begin with, a general introduction too. And with palliative care, ICCOA curriculum, they were all in different settings, which they are here in this case. And so I would have them briefly describe the setting they were in and the team members that they saw working in that setting. So kind of the model of care, and make it, that's a time to set the norm that everybody talks. So I would kind of require that everybody answer the first question. Right. And then you can move into other questions you may have had in general about their writing, or talk about social determinants of health, or what was the model there that you saw, how could it have been better, was it similar to what you learned through the modules, that kind of thing, to get them talking as a group. But generally, once you get them involved, it kind of takes on a life of its own, with you just asking questions and keeping things rolling with the group. So again, you want to ask open-ended questions to get everybody answering and thinking and involved. You want to encourage thought about interprofessional roles and collaboration. So it's always important to keep the objectives of the curriculum as primary as you discuss the cases. What we want them to learn through this entire curriculum about person-centered community care of the older patient. So always getting back to that as you lead the conversation and discussion. And it's fine to briefly share your own insights and experiences, but again, you don't want to move the focus of the group to you. You need to always turn that back to the learners. And it's not the time to lecture.
And I always say, at the end, when we close the reflective writing session, I will usually say, beginning, or I might reiterate it at the end. My hope for each of you is that you leave here and go out into the world with a renewed appreciation for interprofessional practice, and to go out and advocate for each other, because the more we do that, the more of us out there acting in teams there will be. So, that to keep that the main focus, interprofessional collaboration versus specific knowledge content in a specific area.
Yeah, case management experience, or ICME. Now, not every facilitator guide is going to be the same, because as you know, our cases are going to be a little bit different. Like next time we're going to have scripted role play rather than them observing a family meeting. But in every case, you will have a facilitator's guide that goes right along with the slides to follow. So this makes your job as a facilitator much easier, because every step is outlined for you. And the big group facilitator will walk the small groups through this. So this is just one example of an ICME. They will be slightly different. We're doing the case of Jerry Freeman, and the large group facilitator will orchestrate this and start with some general introductions, ground rules, that kind of thing, and explain what we're going to do today, explain the activities. And then there'll be a general discussion among the full groups as to what is integrated patient-centered geriatric primary care. So we're going to talk a little bit about the model, the members of the community team, what an interdisciplinary team looks like and how they function. And all of this is a review of the modules they've done. then we'll introduce the case. And in the case of Jerry Freeman, we start with a depiction of Jerry's care in the community. So this is to give some background on the case and show how the community integrated care model works. And in this case, we have the physician meeting with the community health navigator requesting further information about Jerry and asking for a home visit. So she describes the case to the health navigator, and the health navigator is going to respond with a home visit. Then we have another scenario, and these are short video vignettes of the navigator meeting with the community organizer to talk about what resources are available in the community for Jerry Freeman and his partner. And Jerry has, at this point, moderate dementia, which progresses to advanced dementia as we see him in the hospital. Then we talk a little bit about what happens after these two scenarios, that the health navigator does a home visit and coordinates things, puts together resources, meets back with a physician to report on the patient's care and assessment. Okay, so then we're going to move this case 4 years later. And at this point, Jerry Freeman has advanced dementia and he's in the hospital. He also has been diagnosed with metastatic prostate cancer. At this point, the learners will see this synopsis of the case, which would be the hospital medical record, to learn more about Jerry. And then we have them talk about different aspects of the care. So each small group talks about one aspect of the care, be it psychosocial, physical, legal, ethical, spiritual. Depending on how many small groups we have, we'll divide this up. And then they'll share what they see as the major problems or issues to be dealt with. What we're trying to do is show them how information builds over time and how you need to know all this. And the medical record gives you one perspective, but then you learn more from your interactions with the actual patient and his family. Then we will show some video vignettes of professionals, team members interacting with Jerry Freeman and his partner. And that takes about 20 minutes to show those vignettes. And during that time, we want them to look at the communication and how good was the communication. So you'll have in your packets a clinician communication checklist. And we ask the learners to look at the professional from their own discipline and kind of evaluate their communication in that short video vignette, because we do want to teach good communication skills, and this is one way to target that. We're covering a lot for the learners during ICME, and so we're introducing them maybe to a lot of new ideas, but also evaluating things they already know, like good communication skills. So we show those vignettes, and we have a little discussion of what we've learned about the case from the different disciplines interacting with Jerry and his family. We'll take a break, and then we'll move into the family meeting. And in this case, we're actually going to show a video of a family meeting. In order to prepare the learners for that family meeting, they are going to plan a family meeting and talk about who should be there, all those kind of issues. And you have a handout worksheet for family meeting preparation. So the learners are going to talk about what a family meeting would look like, what will be your goals during this family meeting, who should be there, how you handle anticipation of maybe some family conflict, just generally how you would plan and prepare for that.
And copies of each of these things
Be in
with
the-
a number,
Yeah.
the right
You-
number for
you-
learners will be in the packet that you have. It's all in the exact order.
Yeah.
And your large group facilitator will also be reminding you all, say, small group facilitators, pull out your behavioral checklist, your communications checklist.
The whole group sees the family meeting, the vignette of the family meeting. And after that, they critique the family meeting using, again, another handout, the family meeting behavioral skills checklist. So you can see they're learning a bunch of skills during this ICCOA session, as well as reflecting on their case. This is an evidence-based checklist of what should happen during a family meeting. So you take some time with the small group to critique the family meeting. And then after that, we move into them doing care planning for the patient. And they will get a template for developing an interdisciplinary plan of care. And during this part of the workshop, or the ICCOA session, they work on their own to develop the plan of care. And as a facilitator, you just observe. And you let them do it until you get to a point where you feel like they've covered the issues and they're done. And then you ask them, how well did you do? What could you have done better? Were all disciplines equal participants? Did we hear from everybody? And then you also provide your feedback of their performance.
And do you just sort of let it happen naturally, as far as, I mean, someone is always going to come out as the person who's going to lead the
Yeah,
team?
it happens organically, and then
Right.
again, you try to, you look for that person to lead, but at the same time, not to
Yeah,
be.
take complete
Right,
control.
yeah, because like a few times it's been funny, it's different every time, and sometimes sometimes it's a social work student kind of leading, sometimes it's the nursing student that isn't necessarily leading, but the nursing student might be telling the doctor what they'd be ordering, just kind of like, my
How
own
it is.
experience in real
Right,
practice,
right.
yeah. So it's fun.
Right. They do need to have a scribe.
Well, that was
Right.
my question too,
Yeah.
because you have this document that you're working on, so sometimes that's the same person, but yet other times
Right.
it's not.
Yeah,
and
they
so
each get a
sort of
copy,
let
but-
this- Right.
Yeah, but we pass that around, say, put your name on the top there, and then have someone just record everything on the one sheet. And I do sit back and let them do their thing, but at the same time, I say, okay, you've gotten the discharge plan taken care of. Is there anything else? Because this is a whole plan of care we're talking about, not just discharge planning. What else came up in that video that reminding them of the domains, physical, social, emotional, and so on, and that usually
Right,
cues them.
Right,
Okay.
right. So throughout the session, if you're a small group facilitator, again, your role is to facilitate discussions, make sure everybody's involved, ask those probing questions to get their responses. But again, you're the guide on the ride and not the sage on the stage. So it's just important not to go off on a lecture or a tangent, but to keep it focused on the learners and keep them involved. And I can tell you from our ICCOA experience that the learners love this session
It's their
more than
favorite part.
anything else, because they actually practice their skills. For many of them, it's the first time they've been with learners of other disciplines, which is kind of sad, but it's the reality. And it does really impress them and give them some of the important skills they're going to need when they are in the workplace and working with other disciplines and colleagues. So, questions? Again, with a facilitator's guide and a big group facilitator, there's a lot of structure, a lot of consistency, because it's all spelled out here. So don't be afraid going into it that you don't know what you're going to do, or you don't know what's going to happen next.
And you can just say, hey Tara, hey Barbara, what do I pull out, or what? I mean, it's totally fine. It's intended to be hopefully a relaxed thing, and stuff comes up, and I know Barbara does this too. We hand each student and all facilitators an agenda for the day, so we know roughly what time everything's going to be happening, roughly what time the break is, and we'll adjust, move things along quicker, or we'll shorten the break if necessary to keep things on time. And we've been really successful. This will be the first time we try it this way with the new videos added, but we reduced some slides. So we intend on being very successful at finishing exactly when we said we would and moving through exactly how we we intend. And with regard to the reflective writing sessions, you're the only faculty member going in there. Those students have never done this before. They don't know what to expect. So if you veer away a little bit
Right.
from what we're suggesting, that's okay. You know, you're still going to hopefully create that safe space for them to reflect on the experience and learn from each other.
Right.
So.
And I think it's a challenge for all of us to use the Socratic method rather than the lecture
Yeah.
method. You know, because we grew up learning that way for one thing, but it's not the best way to teach students or for them to learn. So making that switch and always thinking, what can I ask here rather than what can I tell here?
You got this. I already know from experience you do this well too.
Oh, you and I taught each other to do that.
Yeah.
What about for those of us that are not medical, like I don't have a medical background, so ICME, we broke out during part of the day.
We won't be doing that with this one.
Yeah.
Okay, and watched a piece of a video that other people didn't see?
Right,
We're
right.
not doing that?
Yeah.
Okay.
Some of our ICMEs are that way, where you go with your discipline,
Yeah.
you talk about,
Like you
and
do
you're
in
supposed to
reality,
bring
you
it
go do
back
your
to the
assessment and come back and
team.
report.
Yeah. right.
Okay.
But
But we're not doing
it's not
that?
that way.
Okay.
No.
Yeah. We like to keep them together for logistical purposes as much as anything. We love the idea of, in reality, we are, you know, we're an outpatient clinic or we're an inpatient hospital or whatever. We have this patient, we each go and do our assessment, and then we come back and report to the team. And so that's what that model was. The social workers would go and observe the psychosocial assessment by the social worker. The nurses would observe theirs and so on. And then they'd come back and report. Not everyone saw. But it's just a lot of work for
Yeah.
rooms. And really, it does just, because it's also really awesome to let each profession in the room see what a brief interaction is with the other
discipline,
professionals.
Yeah.
What they would focus on.
Yeah.
What else?